Through this historic agreement, in which the state will enjoy a $270 million settlement, the almost $200 million that the center will receive is something that we believe is going to provide treatment and research not only for Oklahoma but for the nation.
You know, I lost my son Brandon 17 years ago to addiction. Opioid was the primary driver of his death. And so we've been trying to take care of our family's loss by trying to help others.
Reggie Witten and I met many years ago, and he shared his story with me and began saying, you know, I don't think we're doing this right. I think there's a problem.
And I was trying to persuade her that med schools, as I understood it, were not really teaching the science of addiction the right way. With these marketing efforts by manufacturers, we needed to take some new steps.
We're one of the first medical schools to provide addiction education within our medical school curriculum and exposing our students. So we were kind of a leader in that.
It is a continuing epidemic. It's claiming lives, and it's not only perpetuating addiction, it's people are becoming addicted.
The opioid epidemic is the epidemic of our lifetime. This is our generation's HIV or Black Plague.
Casey Schrum, in her role as both Dean of the Medical School and President of CHS, and her heart for rural Oklahoma, where the opioid crisis has really been a scourge. And she embraced the problem and that it needed to be fixed.
So we were going all over the state talking about how to prevent this and try to erase the stigma of shame, because people are shamed when they get addicted, but they shouldn't be. This is a disease just like diabetes or cancer.
The opioid crisis is everywhere. It's all over our country. And this center, which is really a national center for the study of opioid addiction and recovery, is a wonderful thing.
Puts us as a national leader and really puts us on a national stage for providing addiction treatment and research.
I'm so proud that OSU is doing what they're doing, and I'm so proud that General Hunter had the wisdom to do this.
Oklahoma State University has realized that if we're going to get ahead of this epidemic, we've got to come at it big and strong.
First thing that we will do with the settlement is to put together a national advisory board, bring in experts to really help us define and focus our efforts, and really, you know, giving us an idea of what we need to bring together and add to our already strong group of professionals.
A big part of the settlement was to curtail production, marketing, and promotion of analgesic opioids into the state. And so Purdue cannot promote those drugs.
We're going to see a tremendous improvement in that, and a center that's going to provide hope for individuals and families that are suffering, that haven't had those resources today.
This is the best way to get this state out of the opioid epidemic, is create this new foundation here at OSU Med School and try to eliminate this epidemic.